I'm Corey, and this is my case study for sectional anatomy. So in this case, we had a 48-year-old male patient that presented with bilateral flank pain and hematuria. The physician ordered a KUB x-ray to rule out any kidney stones, and upon analysis of the x-ray, the physician recommended a CT scan with contrast and a delay of the abdomen and pelvis. Labs were drawn to test the patient's GFR to ensure their kidneys could handle contrast, and the patient's creatinine level was slightly elevated, indicating impaired kidney function. However, the levels were not high enough to be considered a contraindication for the contrast. So now I'm going to move into the normal anatomy of the abdomen. We have the gallbladder, the right lobe of the liver, right kidney, vena cava, small intestine, and the left kidney. And here's another view of the same thing. In this view, we see the liver, the right kidney, femoral head, acetabulum, the left psoas muscle, and the left kidney. Which moves us to our review of the pathological images. On this, you can see the vena cava, the aorta, the right kidney, the left kidney, and then multiple fluid-filled cysts present on the kidneys as indicated by the red arrows. And here's just some more pathological images. Again, fluid-filled cysts on the kidneys as indicated by the red arrows. So the diagnosis in this case was polycystic kidney disease, or PKD. This is a disease in which clusters of fluid-filled cysts develop on the kidneys and impair kidney function. There are 5 stages of PKD that worsen with time and end in renal failure. So the etiology of this, basically PKD is broadly divided into 3 groups: autosomal recessive PKD, autosomal dominant PKD, and syndromal PKD. In layman's terms, this disease is inherited or caused by a mutation in the PKD1 gene. It is possible someone could be a carrier of the gene and not know it. Autosomal dominant PKD symptoms usually develop between the ages of 30 and 40, but they can develop earlier, and 85% of people with this disease will be classified in the autosomal dominant category. Autosomal recessive PKD symptoms can develop as early as in the womb, so this one is way more common in children, but more rare for sure. As far as the treatment of PKD, there isn't a cure, but there are ways to manage it through diet and exercise. Patients diagnosed with PKD can limit their sodium and protein intakes and take hypertension medication to slow the progression of the disease. Patients with PKD should have blood tests done every few months to check the function of their kidneys, their GFR, and their creatinine. And in the final stages of PKD, dialysis may be necessary to maintain a quality of life.